Hey, good morning, everyone. We're so happy to have you all here. I think we have a nice mixture of school social workers, private practice therapists, and so on. Feel free to add your name and contact information and where you're from in the chat if you'd like. We want to thank you for joining us for our second event in our monthly child and adolescent professional development series. We're really glad that you took the time out of your day to join us. I'm Lori Kehoe. I'm a member of the outreach team at SunCloud Health. Just a reminder to those of you who may not know about SunCloud or much about us, we offer integrated, nuanced treatment with residential PHP, IOP, virtual services for adults, and we offer PHP and IOP for adolescents aged 12 to 17, focusing on treating the whole person, and we're located in Naperville, Northbrook, and Lincoln Park. If you're interested in learning more about our services, my contact information, along with my partner, Christy Orr, will be included in the last slide for your reference. But you can make a referral today by contacting me directly, or you can contact our intake number that's listed on the last slide. Please note that to receive your CE credit today, you will need to remain on the Zoom for the entirety of the presentation. Also, you will receive an email including the quiz and the survey shortly after, so please complete these to receive your CE certificate by email. This should take approximately 5 days from start to finish. Our expert presenter today is our esteemed Adolescent Program Medical Director, Dr. Alexander Chevalier. He's a board-certified adult, child, and adolescent psychiatrist who completed his medical training at the University of Wisconsin, followed by his adult residency and child and adolescent fellowship at the University of Illinois in Chicago. He has worked across the lifespan in both acute inpatient psychiatric facilities as well as traditional outpatient practice prior to taking on this role as medical director at SunCloud Health. He has treated a wide variety of psychiatric disorders, including mood, anxiety, substance use, and neurodevelopmental disorders, with a particular focus on childhood trauma, substance use disorders, and eating disorders. And now I present to you Dr. Chevalier.
Thank you very much, Lori, and thank you all for joining us this morning. I know Friday around lunchtime, prior to a holiday weekend, at least for some of you coming up here, maybe not the most fun time to be sitting through a webinar, but thank you so much for joining me here today. I'm going to be talking about the loneliness epidemic. We're going to talk a little bit about some of this as it applies more generally to the US population, and then we're going to talk about my favorite thing to talk about, which is how it applies to adolescents. This is absolutely available as a dialogue. So if you have questions, thoughts that emerge as they're coming out, feel free to put them into the chat. It is not distracting to me or bothersome to me. I like to chat with folks as we're going along. That said, I'm going to try my best to keep things somewhat brief so that we have some time to talk together at the end. I will also be taking questions through the chat at that point in time. So really pick your choice as to when you want to get going with that. And before we get started on the topic, I just want to give a special shout out to folks whose names start with the letter A. We have dominated the field today and are beating the standard Ks and Ds that sometimes win. So if your first name starts with the letter A, we're in good company here today. I was looking at the panelist list. All right. So I'm going to talk a little bit about some definitions here before we get started. We were going to talk about loneliness, as I previously mentioned, but to do that, I think it's a good idea to talk a little bit about what loneliness is and what loneliness isn't, right? So social isolation is a reference to somebody objectively being alone. So that's somebody who is like myself right now in a room with no other people, and folks who are struggling with very limited or infrequent social contact. Loneliness is going to refer to the feeling of being alone. This is something that can occur to people who are in the physical proximity to other people, and it's based on the level of connection and how people are feeling their interpersonal interactions with others. In contrast to that, solitude is being alone or isolated, physically alone, but by choice. So this is something you'd think about when we think about, some people in the monks, the monasteries, Thoreau going to write in the woods for long periods of time. And this is, a volitional thing. We think of solitude sometimes as solitary confinement, and that would be, that involuntary kind of thing. So very different experience. In fact, the data shows, of course, that solitary confinement is extremely hard on the human psyche, on people's mental health, referred to as being an inappropriate way of detaining individuals by a lot of international organizations. And in contrast to that, some of the highest level, folks in certain religious affiliations and philosophers, have pursued solitude. So big differences there based on how somebody gets to that spot. But let's focus in here on the talk about social isolation and loneliness for the sake of today. Right. So there was a big bombshell report a little over a year ago by Vic Murthy, my current favorite U.S. Surgeon General, the only current U.S. Surgeon General. I'm going to say my favorite one that I've known since I've been a physician. He spoke specifically to the epidemic of loneliness and isolation that has been a public health crisis and how it is harming individual and societal health. Our relationships are a source of healing and well-being hiding in plain sight, and one that helps us live healthier, more fulfilled, and more productive lives. Right. We're going to talk specifically on some of the data for that. And again, this is going to be US population based to start before we break down into the adolescent work. His specific report cites ongoing decline in social connection, particularly among young people, which is why we're having this talk today, and how it has a profound impact on health, both mental health and other physical health, including cardiovascular health. And we're going to get into the data on that as well. And in this report, they discuss the antidote being rebuilding the social fabric of the country through social connection. Right, so following that, we're going to talk a little bit about some of the data that Vivek was referencing in regards to social trends. So if this is data that's going to look back from 2003 to 2020, so a 17-year sample, and how much time an average US adult is spending with themselves, an increase of 24 hours per month. So you see there about a 10% increase in time spent just by oneself, a decrease in 5 hours per month with spending time with family, a decrease in time spent with a companion, a decrease in time spent with friends, a decrease in time spent with non-household family, so extended family, and even a decreased time in spent with social engagement with anybody who's in the others category. So coworkers would be probably one of the biggest categories there, but maybe folks that you volunteered with or other things like that that wouldn't fall into the friend bucket. So it is abundantly clear that this is not like a pure remnant of COVID or anything like that. These trends have been pointing downwards for some time now. They have, in some of cases, accelerated, as you see in the social engagement with others, the companionship more recently, but the time spent with friends was already heading down, well before that. These numbers are all declining, and this, again, is specifically set to 2020 so that we're seeing the information prior to COVID really coming up. So a long-standing and large body of public health research shows that a very significant 40 to 80% of health is directly or indirectly attributable to social factors, right? We sometimes get these messages, especially back when I was growing up, that your physical health was a matter of kind of what you ate, maybe how much exercise or movement your body had, how well you slept at night, what substances you chose to ingest or not ingest. And there was never any conversation about how much of health was tied into, who you spent time with, how much time you spent with other people, the number of close relationships that you have. I think the world's done a much better job recently. When I listen to podcasts, targeted towards the adult audience, I do hear constant conversation about this. We talk about like some of the people talk about the pitfalls with retirement and how the cutting off of ties there can affect health span and lifespan. But this is a pretty new concept. And even though it's such a dramatic finding, I think this is something that just people had not thought about and talked about much until the past 20 years. Present day context includes several trends that are making this even more important, of course. One is the aging population, touching back on what I just said there. The older you are, in some cases, the more at risk you are for this. The big changes in technology are really going to be things that we touch on when we get to the adolescent side of things. But those have clearly impacted how our communication and connection with others occur in real life. Certainly, COVID-19 made a big difference at the time, but as the one big benefit that has come from that is my ability to talk to all you coming on to talk here today. It is also, added to isolation and loneliness. I'm giving this big talk that I would have previously given, into a theater or a nice room that we have just adjacent to where I'm sitting here to a crowd of you in person. And as a result, instead, I'm sitting in an office by myself here, although it's cozy. Right. And we've seen an increase in social economic inequality and political polarization, both of which people feel are underlying systemic issues that may relate to some of this. That information is certainly beyond my range of expertise. So I want to bring things back because you're going to hear this conversation about why loneliness is impacting lifespan and health span. There's a classic study done by Emil Durkheim about suicide in 1897. And in this study, he looked at individuals and what risk factors were involved in suicide, individuals who completed suicide. One of the most significant risk factors from that was social isolation. So this is not a new concept. We've had even published research on this for the past 130 years. Social isolation and loneliness, in addition to the things that we've already talked about, they have other mediating factors that go into them. They influence substance use, aka increase it, and they also lead to eating behaviors that are disordered eating behaviors that can increase morbidity and mortality. And so we have the initial, concern related to the substance use, to the isolation, and then the factors that goes through to mediate the increases in morbidity and mortality. Lacking proximity to others that we trust, which brings us safety, increases our state of alertness and increases our adrenaline, causes us to have the fight or flight reflex, both centrally and peripherally throughout our body. If you were, surviving in any part of time before the past, oh geez, I don't know, maybe 100 or so years, the absolute worst thing that could happen to a person was exile. Right. There's no death penalty. We didn't incarcerate you for the rest of your life. You were sent away from the tribe. And that was a fate worse than death because inevitably you would die, without being in the presence of others, without the safety of human civilization. No one person was going to make it on their own. And you had to go through that harrowing process of being by yourself during your last days, waiting to find out what animal or, lack of water or lack of food was going to end your life. And so thinking historically, we've long known that humans being close to each other is where we drive our physical safety, but also where, as a result of that, our brains are wired so that it also drives our emotional safety. These effects have been noted to be particularly pronounced in historically oppressed and marginalized populations, but have also been increasing in white males in recent years. So this is, a thing that's really not sparing many folks. If you take a look at deaths of despair in the U.S. population in the past 20 years, if you were to say hold constant the number of deaths of despair that males were having 20 years ago, so in 2020, I think it was based on 2003 to 2023 data, and just keep that number constant compared to what we actually have witnessed over the last 20 years, there's 400,000 additional men who've died by deaths of despair during that time frame, more than the people that we lost in World War II. Is just that excess bar of people who've passed away, again, through these deaths of despair over those 2 decades. Oops. Well, it'd be good if we could go the right direction. Apologize. Okay, so one of the reasons that are important to understand for why this is going on is understanding the dopamine signaling in the brain. Dopamine is produced in one specific area of the brain, but the place that we think about it the most is in the nucleus accumbens. This is the center of the brain that people often refer to as like the reward center. We think about addiction pathways going through the nucleus accumbens. But really, this area of the brain is telling your brain what to focus on and what to think about. And there's no greater way to understand this than if any of you pick up a phone and ever go onto social media. I personally do not have a TikTok account. I've seen a friend's TikTok video, but I am told there's nothing that drives more of these micro bursts of dopamine than just scrolling through TikTok, right? And certainly if you're on any type of social media, getting that like, having somebody, speak to you or retweet you or respond to you, those are all things that drive these little bursts of dopamine through the nucleus accumbens. And that's, again, telling our brain what to pay attention to. It's that feeling of like, oh, I'm doing the thing I'm supposed to be doing. That's such a powerful motivator of human behavior that we had for the longest time thought that that was just reward. we always thought that like, oh, it's saying like, you take some cocaine and increases the dopamine in your nucleus accumbens. It must be the reward that that's generating. But actually what it's doing is just telling your brain you're doing the right thing, right? Doing that cocaine is at the time telling your brain that that's what you should be doing. Just like scrolling through TikTok, or, waiting to get how many more likes is telling your brain, oh, the thing you're doing is the right thing that you're doing. That process is a very complex process and it's mediated throughout the rest of the brain. So you have parts from your prefrontal cortex, that's the part of our brain that separates us from the other animals in the world, that's responsible for executive functioning, planning, all the inhibitory control, all the fun things that make humans humans. But it's also wrapping through the sensory inputs, the things that you're hearing, smelling, tasting, touching, and it's going all the way down to the rest of your body to tell your body what to do. So nucleus accumbens and the dopamine signaling is so powerful that it's literally driving your body to do things. Again, part of the reason why it's the major circuitry that's involved in addiction in the human brain, but also the thing that's telling your brain what to pay attention to when it comes to these social connections. Right. And instead of you getting that little burst of dopamine by sitting in a group of your friends, talking, somebody's laughing at your joke, you're connecting with somebody, you're meeting up with an old friend and just sharing those inside jokes that we all know, like make us feel good, make us feel like we're doing the thing that we're supposed to be doing. At least certainly the case for me, that has been replaced with doing it on a cell phone, right? Or doing it on a computer. And this is why. So when we think about social connection, there are three specific components to be thinking about. The first is the structure of those connections. So that's the number and variety of relationships and the frequency of those interactions. The next is the function of the relationship. So that is what needs are being served by those relationships. And then the last is the quality of those relationships. So what are the positive and negative aspects of those relationships and interactions? So we can think about, the number of people in our household, the number of people in our friendship circle, if we have a partner or not, and what those relationships look like structurally. Then what role do they play, right? So maybe, the boss at work or, even somebody you grew up with can play that role of mentorship. Maybe, some good friends or partners playing the role of emotional support. Maybe some of those same people or even different people are playing the role of support in a crisis, right? And then there's that overall feeling of, what's happening as a result of these relationships. Excuse me. Am I getting, what I'm putting into it? Am I getting more than what I put into it? Are there things that are making this relationship take away from me? Am I feeling included with my friendship group, my coworker group, my household group, or am I feeling excluded from those groups? So Okay, sorry about that. Loneliness and isolation contribute substantially to the mental health problems, as we're going to continue to talk about. And so in adults, the risk of developing depression among people who report feeling lonely is double that of people who report rarely or never feeling lonely. Loneliness and social isolation in childhood is known to increase the risk of depression and anxiety, both immediately and in the long term. Again, we're going to touch on that in a little bit. And then more than 1 in 5 adults, and unfortunately more than 1 in 3 young adults, live with mental illness these days. And addressing this connection between loneliness and isolation, as well as mental health, is going to be critical as the number of mental health disease incidences rise. We kind of know one of the main causal factors right here in front of all of us with the loneliness and isolation. So just to get back to a real quick part on the physical health side of things, obviously this is a talk given to by a psychiatrist, not a cardiologist, and so I'm not going to pretend to have more domain expertise than I do. But real quickly, just so that you understand what's at stake here, they took a look at ranking cardiovascular health based on a variety of different things that we know negatively impact cardiovascular health, right? So things like smoking cigarettes, for example. And they were able to show in this study that lonely people had a 29% increased risk of heart disease, a 32% increased risk of stroke, a 50% increase of developing dementia for older adults, and premature death rates were increased by more than 60%. Right? And if you compare that difference with lacking social connection, it's in the same band as smoking 15 cigarettes daily, and as you see here, actually even higher than that. But confidence intervals being what they were, we have to say those are equal. And it is significantly more so than even drinking 6 alcoholic drinks a day. Right? So that is a very heavy drinker, having no physical activity, being obese, being in an area with very bad air pollution. None of those things, or even if you add them all up, are honestly pretty close to just the negative health effects from lacking social connection. So what are some of the reasons why we're struggling to address this? One of the big ones is the idea of just don't talk about it, right? People often don't share that they feel lonely. If you go to catch up with a friend that you haven't seen in a couple years and you say, "How's it going?" It is pretty socially uncommon for somebody to say, "I don't know, it's been really tough because I've just been so lonely and not been able to have meaningful relationships with people in my life." Right? I think that conversation has maybe never happened in the history of mankind or a handful of times prior to a few seconds ago. Right? So our society particularly makes it shameful, and there's a lot of stigma with talking about loneliness, even in an era where I think it has become much easier to talk about things like depression and anxiety. It is often, I think, easier for people to say, I've been really anxious, I've been really depressed, than it is to say, I've just been really lonely. Something that's not a psychiatric disorder, something that so many people, if not every person, has experienced to a significant extent at some point in time in their life or other. We just have such a hard time talking about it. And so for people that are lonely, they end up just internalizing those feelings. Right. And when they do end up talking about it, if they do find a great person to listen to, maybe it's not the first thing they say in a conversation, but as you go meeting up with your friend, you're talking about things, you're talking about the good, you start talking a little bit about the bad, and you say, actually it's been tough, there's feel kind of isolated, feel a little lonely, listeners often go into one of two modes. The first is the fix it mode, like, oh, you're lonely? Well, geez, I mean, just pick up the phone call, call me anytime, like, let's schedule a meeting every single week. We're just going to keep talking about it. Or they go into this other mode of saying, like, geez, it sounds like you're not doing a very good job, like getting out there socially. Why aren't you at that, a softball game or going to volunteer or do all these things? So then you just have more friends, right? And so, this is a big, big part of why we're really struggling here because we have a real, real problem and it's hard to talk about. And we haven't done a good job destigmatizing it like we have some of the other areas of mental health. And loneliness in particular is hard for adolescents to talk about, right? In adolescence, your value is your social capital, right? In some cases, maybe your physical prowess, your academic prowess, but by and large, the most popular kids at school are not there because they have 4.0s, maybe because they're the captain of the football team. But if we're being honest, it's probably because they have the most amount of friends and have the greatest social capital. And so, to be a lonely adolescent is really to just say, I'm at the very bottom. I'm somehow failing in the thing that adolescents are supposed to do the absolute most of. And obviously, that's a very, very hard conversation to have. So, talking about a little bit about young adults into the childhood ages here, taking a look at what has happened with suicide and homicide rates in the past 20 years, there has been a very clear trend upwards for suicide, particularly notable following 2013. Right, this data of the upward trend in suicide since 2013, basically the first year that over 50, not basically, it is the first year that over 50% of adolescents had a cell phone in their pocket. And the rate at which this has gone up and a little bit of dip, but not really come back down. We went from roughly, 8 for every 100,000 in 2013, and the numbers are definitely north of 10 now. I think the data, if you come out to 2024, are going to look closer to like up here when you're talking about this 10 to 24 age cohort for suicide. Similarly, the numbers with homicide, they've had their ups and downs, but has certainly spiked more recently and have gone up. So these processes are absolutely changing and increasing. This is not, some blip in the map. We have not, seen anything other than a 1 year period in which they've come down and then immediately went back up following that. And like I said, the following data, we don't have data, of course, for 2024. I haven't seen 2023, but I know 2022 is past the spot right here and is still trending upwards. So this is just kind of the backdrop of why people are so concerned about this right now. And again, now we're sort of shifting gears to talking about the younger age population. Before we talk a little bit more about adolescence, I probably should have switched these sides. I apologize. I do want to talk a little bit about some of the things that Vivek has outlined for ways to address this from a greater societal perspective, right? We're going to talk about it from an adolescent perspective in just a minute here, but from a greater US population societal perspective, what can we do, right? Pillar one is to strengthen social infrastructure in local communities, right? And everything has been kind of decided that local is the way to start, right? So having environments locally where people can engage, can interact, third spaces, in particular for both youth and adults have really fallen by the wayside. The data on that's pretty profound. And this lack of third spaces, I think almost everybody is kind of understanding to be a major source of concern. changing policy to promote connection in places, right? So anything that can be done to get people together from a policy perspective, and making sure that everybody is working on this from a legislation perspective. We need money for these initiatives. We need purpose for these initiatives. And so we need a reason for people to be getting together and funds in order to make those things happen. We need the healthcare sector. We absolutely need to be finding ways to use and train folks in family medicine, mental health, in our primary care offices, to be understanding when loneliness is coming up, right? You cannot go into a doctor's office and not get screened about what's your cholesterol level, how much is your movement, how much alcohol are you drinking, how many cigarettes are you smoking, right? We demand that our doctors ask everything about that, right? If they ask questions about how many friends do you have, how much time do you spend with them, right? Even though it's a bigger risk factor than every single one of those things that we just talked about. Right. We need to really strongly feel about this one, work to reform some of the digital environments. Right. There's going to be further knowledge, discussion about this in the adolescent space, but coming up with safety standards in ways in which, we don't have the largest billionaires in the world go to Congress and say, it's the algorithm. There has to be more done from a legislative perspective to legislate over the digital space. And not to do this guise of like, oh, anything goes because it's free speech, and thus we have to let everything happen as it's unfolding online to make sure that the billionaires have additional billions of dollars. The fifth thing is really to deepen our knowledge, right? This is, like I said, something that was just not talked about when I was a kid. I don't remember a single conversation about this my entire life, going through health classes in middle school, in high school, even my very well done, classes about this in med school had basically no conversations about this. And I went to a medical school that focused on public health. I'm old now, so that was 15 years ago. But this is clearly an area that it needs more research done, particularly around the intervention side. And then lastly, we're going to keep talking about this, but building a culture of connection. Right. And this is a really difficult thing to do, but a really essential thing to do, that when we're in schools, when we're in workplaces, when we're in communities, that the culture is one of kindness, respect, appreciating other people's perspectives and differences. And as everybody knows, we've really pulled away from that, if anything, in recent times. And there's a lot of concern associated with that. So now getting to the fully adolescent side of this talk, just to start things off here, what happened during COVID? Well, obviously not good things. Very tough as expected for adolescents and school-age children to go through the pandemic. There's obviously no real preparation for it for anybody, but kids were thrown into these systems that were pretty tough. So there was a significant increase in loneliness for adolescents during COVID. 49%, for example, reported less involvement in extracurricular activities. Not a big surprise. I think, if we had to go back and do some things again, finding ways for kids to interact in safe ways, like outside, in particular, probably would have been pretty high in the list of things to do. But, everybody was doing the best they could during this really difficult time, and everybody suffered to some extent. But unfortunately, if you take a look at the data, it was really the youngest of us that suffered the most. So young adults in particular, aged 18 to 23 during COVID, had the highest rates of loneliness of any age cohort. So they broke things down to, young adults, like, I don't know what comes after young, but before middle age, boomers, and then even the very oldest individuals in society. And so young adults in this case had 63% reporting being lonely during COVID. And just to give you a point of comparison to a group, over double their age, 35% of boomers during that time reported being lonely. Adolescent loneliness absolutely impacts mental health. So there's been a lot of research on, not, I say a lot, almost reflexively. There's been a little bit of research on this, and there needs to be a lot more. But the initial research has shown that there is a bidirectional relationship between loneliness and mental health disorders in adolescence. And so what that means is that if you're lonely, it increases the rate of mental health disorders. But for people who struggle with mental health disorders pre-existingly, that also goes to increase their rates of loneliness. So we're talking about those very kind of pernicious back and forth things where one drives the other one drives the first one. And unfortunately, things go back and forth. We see this, for example, in cases like adolescent cannabis use, where the cannabis use is there as a result of somebody's anxiety or depression, but then the cannabis use makes the anxiety and depression worse, so then there's more cannabis use. The same thing's going on here between loneliness and mental health disorders. And so, as we know, the rate of mental health disorders are rising and the rate of loneliness is are rising in our adolescents. And so, those two are just going to continue to feed into each other and make both of the issues worse, unless something significant is being done. This is honestly one of the most common reasons why adolescents come in for treatment and SunCloud Health, although they never phrase it this way. I will tell you, having done now hundreds of evaluations for adolescents that come through our doors, they will always tell you like, oh, I just started getting, really sad. I stopped going to school. I started cutting myself. I started using substances. I stopped eating. I started purging. All these different things about why they're coming into your front door. An hour and a half into the conversation, it comes out that, well, a week ago, all my friends dropped me, right? And now, I have nobody. Or, somebody said that I did this thing and this other thing, and now all these people are giving me a super hard time both at school and online, and I just feel terrible, right? And so this loss of friendships and or acute bullying ends up being an overwhelming driver of some of the worst mental health outcomes that we see. Everybody's favorite topic these days, which I'm really glad it is. Jonathan Haidt has done an incredible job bringing this to the zeitgeist, and I really appreciate him and all the other researchers working hard to come up with more data for us about adolescent loneliness and social media. Thus far, the data has been pretty bad. It shows that if you break down adolescents into quartiles, the quartile who use social media the most compared to the quartile who use social media the least, they have 2 to 3 times higher rates of loneliness, which is kind of an amazing number because the base rate of loneliness here is, well into double digits, right? 20, 30%. So multiplying that number by 2 or 3, ends up leaving numbers where the overwhelming majority of people that are using social media at the highest rates are getting lonely and feeling lonely. There's a lot of this discussion about the concept of FOMO. That's for those of you who don't know, but I think probably all of you on this call do, the fear of missing out. And so when you take a look at adolescents and have them rate their self, there's, believe it or not, there are FOMO scales. I can't believe that I'm that old that the thought of that actually boggles my mind. But when you give adolescents these brief FOMO scales, those that have the highest levels of FOMO also have the highest levels of loneliness. And there's a bunch of data which is beyond the scope of my talk today, and I don't have listed for you here, but that FOMO is increased by increasing amounts of social media usage. So when you put 1 and 2 together, it's very clear that these individuals that are struggling with lots of social media use end up having higher rates of FOMO, higher rates of FOMO associated with higher loneliness. It's kind of wild that the mediating factor potentially between the higher social media use and higher loneliness rates is FOMO, but, again, here we are, 2024. Another thing that's a big takeaway from the social media usage and how it impacts mental health is that in particular, passive social media usage is associated with the worst overall impacts, the highest feelings of loneliness, the most feelings of depression. And I will have patients reportedly, not infrequently, you ask them, how they spent their, Thursday evening, Saturday evening, and they'll tell you I was just doom scrolling. People even understand what is going on inside their head, and they still can't stop themselves from doing it, partially related to the dopamine pathways that we were talking about before, partially related because they just don't have a concept of what else to be doing during that time. And that type of passive intake of the social media is definitely the worst. In contrast to passive social media usage, active social media usage would be if you're like posting on message boards and forums and having conversations back and forth. Of course, sometimes those can go poorly as well. But that type of social media usage where you're actively contributing and actively part of a community and regularly posting, you'll see that, for example, like on Discord is probably the social media platform where that's most prominent. And that's where people are like connecting over a specific thing. It's like a video game or an anime they watch or show they watch. And it's a whole bunch of people who share this interest and are going back and forth about things. That type of social media usage can either have neutral or sometimes even positive effects on mental health, which again, I don't have the data for you here, but you'll have to take my word for it. And so that's a type of social media usage if somebody had to be involved that we'd want to be promoting. TikTok, unfortunately, is kind of the queen or king of passive media thing where you're just scrolling through the videos, and that has certainly been linked with the worst mental health outcomes and the most amount of loneliness. Okay, so talking about what we can do about it. I'm trying to speak on kind of a school level here, which is a little bit tough because I'm not an educator by training and I have not worked in a school. But these are some of the common threads that people are working through. There is not a lot of data in this space, and I really wish there was more. But this is kind of what we do at SunCloud and how it can be branched out a bit into schools. Okay, the first part is not what we do. The next couple are. As far as social connection is concerned, one of the big parts is having extracurricular activities with as broad array of interests as possible. I am so heartened when I go into schools today. I just got back from going to Warren Township in Gurnee, and I saw signs for, video game clubs. I saw signs for all these things that would just have been totally out of the blue when I was going through high school. I mean, we, of course, had all the sports. I was a proud leader of the math team and the quiz bowl team. But there was absolutely no way you were getting, an anime fan club, a video game club, even like the fashion clubs that I've heard and seen about now. I've never, not that I would have joined them, but I never would have seen or heard access to in high school. So I think schools have done a really great job. A few things to keep in mind, obviously keeping the fees as low as possible, options for scholarships to connect anybody who wants to be, having a variety of times, the beginning of the day, after the day. Be amazing if more of these could be done during the school hours, although I totally understand that there's barriers to that. The options for these clubs are so endless, and just making sure that everybody has a space, and so that kids are continually being asked kind of what kinds of clubs do you want. I cannot tell you how many kids sit across from me in that chair and tell me about their significant interest in a club that literally never existed when I was going through high school. And I'm just so glad that they have a place to find their people. Obviously, a big part of this has been the equitable sporting options as well. There's, of course, some amazing women who made that possible. And nowadays, the real thing is equitable sporting for all genders. Of course, again, we've done such a good job with women, but we need to have it for all. One of the things I will say is why I kind of tongue in cheek was describing how great it was that we had the most number of people whose name started with an A. It just feels different when you're in a smaller group, right? So all of you listening to this whose first names start with an A, hope you feel like a little bit closer to this talk today, right? When you can take a group of 50 or 60 people and break it down into those smaller groups, everybody has a different experience, even if it's a completely artificial one. And we'll talk about that in a second, right? Part two is going to be all about the culture. And so you just have to be from the top down, everybody involved, a culture where both bullying is punished and standing up for others is rewarded. And if we know anything about basic psychology for all humans, but certainly adolescents, you make the hay with rewards. Right. And so anything you can do to use the carrot instead of the stick is going to be more effective. But I do think in the case of bullying, there absolutely needs to be some stick involved. And I don't claim to have to deal with parents or be a vice principal or teacher and deal with the horror that comes from that if you're ever punishing a bully. But I think these are an absolutely critical part of current schools. Again, I was so heartened walking through Warren Township this morning. They have huge signs talking about that bullying is unacceptable, that bullying will be punished, and that to come to these places if you're experiencing this, who you can talk to, the resources that are there. This has to be something that permeates throughout the culture. For us here at SunCloud, this is a big, big part of making sure that every single teenager who's coming into our groups knows that this is a safe place. You can talk about really tough things, and if people are giving you a hard time, we are going to say something about it. And if other people are defending you, we are going to praise them for it, right? So anything that schools can do to nominate students who are doing a good job pulling in kids who look lonely and isolated, or standing up against people who are trying to ostracize students, I think is amazing. Excuse me. Those peer nomination processes feel great for people, and it's great training to get into the habit of being able to talk to people that are your peers and tell them that they did something good, right? We need more of that in this world, and it's not just the recipient who benefits, it's the person who gives, that kudos, that plus. There's tons of psychological literature to support that it's equally effective for both the person who receives and gives that kudo to make a big difference. And of course, having staff be an example and show up how to do this, I think makes a huge difference too. I was trying to brainstorm as I was writing this, how can we make rewards meaningful as opposed to an attaboy? I know nothing really, again, about being in school. Are there privileges that can be given? Are there ways to make this part of a permanent high school transcript? That matters for a lot of kids these days. Just anything that can be done to make the culture happen where you are rewarding people for pulling in, the kids who are sitting by themselves at the lunch table and standing up to people who are giving them a hard time. I think at the annual assemblies, there has to be a culture of inclusion and connection at school. This has to be a theme that's driven on every single year about coming together. And actually, I think one of the nice ways to do it is utilize the old school us versus them, right? This can be done in a friendly, helpful, healthy way, right? I like to joke about Chicago Bears fans all the time because I grew up 30 minutes from Lambeau Field. And of course, will always be a supporter of the Green Bay Packers, but have now lived in Illinois for over a decade. And I love giving Bears fans a hard time, especially now that it looks like you have a good quarterback. It's going to be an even better rivalry and much less one-sided. But these things can be done in a very healthy way. And, having our school and our people versus other schools can drive some of that inclusion that you need at your specific school. The last one that I think is really critical, and I don't see get done in a lot of places, but I do love the folks in the places where they're trying to make this happen, is peer mentorship programs, places where you can have, somebody who's been in a program for a while is the equivalent for us in a, PHP or residential setting. But at your schools, it's the upperclassmen, and they can choose to have, a group of kids that are getting started, to be part of something where they work with them. If I was putting this together, I would have, required school day participation for all of the freshmen that were, and nobody stands out. It just is what's going on that day is you're meeting with your mentor, right? This doesn't have to be overly disruptive to the upperclassmen because not all of them are going to do it. And you want to have a group around, each individual upperclassman. These artificially created cohorts have a long body of evidence for improving connection. Even though I also like to rag on fraternities back when I was younger, they have much higher graduation rates almost across the board for people who join fraternities in college versus people who don't. I always thought it was really silly, and I actually would say sad, that people had to have an artificially created cohort because that meant you couldn't just go create the cohort yourself. But as I've gotten older and wiser, I've seen the data and the value, and sometimes it's good to just have this artificially created cohort. Just like I was saying with all the folks whose names lovingly start with an A here today, those types of things can actually make a big, big difference, right? And I can't even imagine what high school would have been like if I was like hanging out with a senior or a junior, and like 8 other people that I would have otherwise not had in my classes that weren't in all, honors and AP classes with me. I think I would have had a very different perspective, honestly, throughout high school, although I'm sure I still would have probably been a jerk, and too confident in myself, but that's a story for another day. Options for this include, peer drop-in support. I think is great to have. There's obviously only so much that the incredible people on this call can do. That if you work in school mental health, the school resources are of course going to be limited, and the demand for these services I know have been high, and people's days get really busy. So any way that we can get other kids part of the solution, I think makes a big, big difference. Right. I'm just going to wrap up here with creating that culture of collaboration from a school perspective. I know we talked about it from a societal perspective. From a school perspective, I think the top things are really having representation that's inclusive amongst the teachers and the leadership. So that is about everything, having different genders represented, different races represented, different social economic statuses represented, and people with different varying interests represented. Makes a big, big difference when kids can see somebody who shares something in common with them. We all know that the data is profound on that, but still needs to be said. Anything that can be done to collaborate between the two teachers and students to show them, that you're committed to this culture of collaboration. I really like the idea of collaboration in projects and, giving scores and bonus points based on that. I remember getting so mad about getting docked points for not doing this well in high school and just being irate. And in reality, I, of course, just completely missed the message that the point is not the final product. The point is how can you bring everybody up with you together, right? And actually, would have helped if that was more declaratively told to me, but nevertheless, I think that's great. And anytime you can do cross-disciplinary collaboration, I thought it was super cool how some of the English and history teachers would work together and have somebody do an assignment that was for both English and history at the same time. I wish science and math and some of these other places did that too. Maybe you guys do now. Of course, meeting any student where they're at, just saying, how can I help, right? If kids are struggling, what can we do to pull them in? If they're isolated, how can we make them less isolated? If they have unique interests, how can we find somebody else who they share something in common with? And then lastly, something I feel really strongly about. I know schools are starting to do a lot more of this, but we have to have curriculum focused on the emotional intelligence side of things as well. So things about empathy, effective communication, understanding your own mental health. These are critical concepts for people to understand, so that they have the words, so they have the vocabulary to have these conversations if they are struggling, and for somebody else to hear them and be like, it makes me a stronger person to help you when you are struggling, as opposed to you are struggling, so I quash you with my foot and gain bonus points societally as a result of doing that. So that's my talk today. Thank you all so much for coming. We've got some options for you to reach out to if you'd like to get in touch with any of our liaisons. Both Christy and Lori can get you in touch with our intake team, get somebody slotted in to see me or some of our other folks who are doing assessments rapidly if any of the students or teens that you know are struggling. And then at this point, I'm certainly happy to answer any questions or just listen to any thoughts you have on what's been going on with adolescent and US loneliness lately. And thank you so much for your time.
Thank you, Doctor. We do have one question in the chat.
Yeah.
Are you able to see that?
Sorry. Sure. I'm going to read out loud. I'm a sex therapist and have some clients in the 18 to 22 range who self-identify as incels. They really attach to these new hateful people like Andrew Tate who preach these very toxic views of masculinity. So as boys, they're feeling deeply lonely and then attached to this rhetoric and then continues to isolate them from others and amplifies the loneliness. Incels can be a massive topic to address, but I'm wondering how you see the specific hateful brand of loneliness factor into what you're talking about? That's a great question. Thanks so much for bringing that. Yeah, I think this rapid expansion of these folks like Andrew Tate are really a symptom, right, of a disease. And if you take a look at who is really struggling in the age range of adolescents and young adults, it is absolutely overwhelmingly males, right? Males are ending their life at a rate of about 3 to every 1 for females. In this age range, and they are bearing a huge brunt of what's going on. They have significantly lower high school graduation rates, lower college graduation rates, and are now being out-earned by females, when they're in the young adult range. And so, when people are struggling, there's going to be a void of people trying to come in and say, I have the answer. And unfortunately, into that void have become people like Andrew Tate, who I agree have awful, awful messaging. I will say, just as an aside, I do find the description of toxic masculinity really tough. I think if never heard anybody say toxic femininity before, and the way that we're associating the word toxic with, one of the 2 genders that's most prominent, obviously there are more genders, I think it's just adding to people wanting to go listen to Andrew Tate. When they hear people talk about toxic masculinity, when they hear people talk about how men have created so many problems and have done so many bad things, which they have, it certainly adds to this push to somebody saying, like, I have the solution for you. So, this self-identified incel space is somebody who really needs help, right? This is not somebody who's doing well. Nobody in that age range is like, crushing it at life, doing great at school, dating as they want to be, having a successful job. And it's like, oh, I'm an incel, right? This is just a new way of saying, like, the world has kind of passed me by, and I don't feel heard, I don't feel seen. What am I going to do about it? And the things that get the most number of, messages in social media come from, this unfortunate, negative, immature masculinity is probably how I describe it, manosphere. And it's obviously doing nobody any good. It's obviously hurting the people who are listening to it, but it's hurting women too, because then they're encountering these boys and young men and older men who have these views. Right. And that's not good for anybody. So this is a big problem. I agree with you that it's a much longer talk, but we have to find a way to reach young men and make sure that they know they have a place in this world. In fact, most of the talk today was honestly just about men. But if I say it that way, I think it bothers some people and they get offended. Overwhelmingly, the people who are taking their lives, dying from dust to despair, who have the highest rates of loneliness, they're boys and they're young men. And it's definitely something we need to do more about.
Thank you so much, Dr. C. Just a few things before we wrap up. I just want to remind you that Christy and I are here not only to help you navigate referring a student or a client, but we're also here to help plan ways that we can come into your school or meet with your staff or meet with your families and provide education to increase awareness and connection. That's kind of my mission this year, is to really, and so it was so timely that Dr. C gave this presentation today, because we can be the examples of how connection can really help us help each other and help others that we are trying to serve in our roles. So please reach out. And again, you will be receiving an email. It should be coming from Tammy. that will have your survey and your quiz. And so please fill that out so that you can get your CE certificate. And again, we want to thank you. We're going to have 2 more presentations in this series. So look out for the reminders on those to register. And we just thank you so much for your collaboration and being here today on your day off, or maybe your school institute day. And I hope that I get to meet you in person. And I'd love to bring Dr. C along to provide your staff with a free educational opportunity. So we just thank you all for the work that you do. Have a wonderful weekend.
Gabriel, I wanted to add, if you're looking for some counter programming that's maybe a little bit more reasonable to direct some of those individuals to, this is just a it's unmarked solicitation for I have no financial relationship with, but I find Professor Scott Galloway, or Prof G, as he goes by, he has some pretty big time podcasts and gets out there a lot. His next book is going to be on modern masculinity, and he does a lot of work to try and describe, a positive version of masculinity for the future, and do some work to, show a different way forward for young men. So I think that would be a potential resource. You're obviously welcome to go screen some of his recent podcasts or anything like that, and see if any of those you think would be helpful for your clients. But if they're people who are used to like digesting things from like YouTube videos, or shorts or podcasts, I think Prof G, even though he's older, I think he's 60 now, he does a great job really utilizing these newer mediums, and I really like, his approach to masculinity and what he has to say on the topic. So that would be a potential option for some of those clients. I hope you all have a wonderful weekend. If you do get the day off Monday, enjoy the holiday for our Indigenous people of this great country. And thanks again for your time.
Thank you, everyone.